Good morning, everyone. Good morning, everyone. It's October 25th, 2022 at 10:10 a.m. And this meeting of the Texas Behavioral Health Executive Council will now convene. Although I am typically chair, I just want to gavel us in and explain that I could not be in Austin today, and it is required that the chair be present in Austin to conduct the meeting. So at this time, I'd like to hand over the gavel to Mr. Stephen Hallbauer. Stephen, thanks so much for taking this on. I appreciate it.
Absolutely, Chair Canseco. I will do my best to uphold the high standards that you have as chair of this council. Let's go ahead and do our roll call. Chair Canseco, if you just quickly introduce yourself, we'll go ahead and still start with you.
Okay, I'm Gloria Canseco, chair from San Antonio, Texas.
Okay, Mr. John Belemowitz.
Present.
Mr. Brian Brumley.
Present.
Dr. Mark Cartwright.
Present.
Mr. George Francis IV.
He's muted.
George muted.
Sorry about that. Definitely present.
And we do not have Ms. Rogers at the moment.
Correct.
Correct.
Oh, here
Is she?
I just got an email from her.
Okay, give me just a second. We're checking on Ms. Rogers. She'll be here in a second.
Yeah, I'm gonna have to resend her the link.
Asia will be here in a second. Let's continue on. Ms. Janine Smith
I am here.
and Dr. Chris Taylor.
Here.
Thank you. And I'm Stephen Hallbauer. I'm chair of the LPC board, and I'm gonna be the presiding officer here this morning. Asia's gonna jump on, but at this time, I will go ahead and hand it over to Daryl for number 3, the informational items.
Okay, I've got several items in your meeting packet this morning, most of which are going to be self-explanatory, so I won't spend a lot of time on them. The first item up is going to be the fourth quarter performance measures, and you'll notice this morning that not only do you have the quarterly performance measures, but I've also included the annual performance measures. There are 2 different sets that we keep, and the annual is what it says. You get it once a year at the end of the fiscal year, but in short, I mean, we're looking good on everything. The numbers are either where they ought to be, or they're better than where they, where we had planned for. So we're in good shape. The one number that I pay particular attention to, because it was such a focus during Sunset, is the average time for complaint resolution. That's right there in the, I think it's in the 400s, if I'm not mistaken, if I'm remembering right. But it continues to come down. So I feel like we're in good shape on that. So I don't really have any concerns there. And unless I hear any questions, I'm going to move on. Next item is going to be, and of course I included the performance measure calculations there too, all that if you needed to see that. Next item is the budget. The main thing that I would point out in the budget, there's nothing, nothing spectacular in the budget other than you'll notice there's a little over a $200,000 lapse in there. Again, most of that is due to unspent salaries. There was some just open positions that we have throughout the year is what aggregates up to that $224,000. Some of that is data center costs that we had been appropriated that we ended up not using. Our data center expenses actually came in a little less than what we were anticipating, so we lapsed that back to the state. You can't really do anything else with that money. It's a dedicated amount. It has to lapse back. So other than that, nothing out of the ordinary or strange in the budgeting process there. Next item is going to be the licensing, the efficiency measures for licensing. Let's see what we got here. I wanted to include, you'll see in your packet that you've got a chart that Tim prepared that shows the legislative inquiries. The reason I showed you, I put this in there, and I think I may have shared this with you all via email. I just wanted to show you the stark contrast from when we started in fiscal year 21 to where we are now. We started out from 346 legislative inquiries, which is a lot, during that first rocky year. And we have had, I think, 2 so far in this fiscal year in 23. They're just not measured on that, but I'm just telling you, we've had 2 so far. We consider that to be a huge improvement. When you're off the legislature's radar, that's not a bad thing. That means you're staying out of trouble with them. So I think that's a pretty good indication that the agency is doing what it was set up to do.
Bravo.
And then that's really a product of the licensing division staff and the staff attorneys in the enforcement division. They've all busted their tails to get us where we need to be. Hang on, I'm looking at an email from Ms. Rogers.
She's here.
Is she here?
Yeah,
Okay,
let's-
okay, good deal. All right, good deal. The next item is going to be, I included just a index to the staff positions, just to kind of show you what our staffing levels look like. That'll give you some idea of what it takes to perform at certain level. You can see, okay, this is kind of the performance we can expect with this staffing level. You'll also notice in that staffing index, we're going to make some changes over in the licensing division. Because of some efficiencies that we've achieved over on the social work side, I'm actually going to pull one of the L&P social workers from that, and we're putting them over on the counseling side, because the counseling program is just running like gangbusters as far as applications that are coming in. It's a very high volume program. Social work, they've got their stuff kind of dialed in over there. I mean, everybody's got it dialed in, but they're really synced in. I think a lot of them are already cross-trained in their positions, so that helps tremendously when somebody goes on vacation or what have you. So we're going to add one person over to the counseling side, and then we've got a few more vacancies that we're trying to fill. We've got 2 receptionists right now. I'm going to try to hire a 3rd. It's really difficult right now to hire a receptionist because of what we're offering as far as pay wise, and just nobody wants to come to downtown Austin. I know I sound like a broken record whenever I say this, but sometimes I feel like if I don't say it, people forget kind of what we're struggling with here. It's still a struggle. The staffing issue is on the receptionist side. But other than that, we're rocking along pretty good. I'll be honest with you, I'm going to tell you all the same thing that I told when I had the joint budget hearings the other day. Everything's rocking along actually pretty good. There aren't any major hiccups or problems that we're suffering. The only problem that we can really point out is the staff turnover, and that's not due to internal politics. That's just the nature of somebody can find more pay somewhere else. So that's something that the legislature is going to have to help us tackle. Yeah, Ms. Smith.
The question that I had, when I compared the budget to what we still have in staffing shortages, how will that play out going forward if we have used all of our budget, but we still have this area that we need more people? How does that balance? How will that work?
Well, you will never use all of your budget. You're almost always going to have, in an agency this size, you're almost always going to have money left over at the end of the fiscal year, because the larger you get, the more likely it is you're going to have vacant positions at some point, different times throughout the year. And all that money is going to aggregate up to, a couple $100,000 at the end of that fiscal year. So I think you should probably get used to seeing a certain amount of funds lapse. What it'll be will change from year to year. But we better never find ourselves in the position of having vacant positions and no money left to fund it. That means that we have allocated all that money to something else somewheres, and now you've got an FTE position with no way to fund it. That unless you have identified that position as something you want to cannibalize, you no longer need the body, but you need the salary to do something else, say increase salaries in other positions. In that case, you might find that.
I think you answered my question. I just wanted to make sure that even though it looked like we had spent most of our monies, that we always allocate more to fill these staff positions? That was really the question.
Oh, yes, yes.
Okay,
Yeah, yes, we have the money to fill all those positions that are.
Okay,
vacant.
that
There-
was
there
really my
isn't-
question. I
yeah.
didn't say it correctly.
I'm
Thank you.
sorry. Let's see. The next item is going to be the enforcement efficiency report, the fourth quarter report that Alfonso puts together. It kind of speaks for itself. I think, Patrick, how many pre-20 cases do we actually have now? I know this report's outdated already there.
There's 5.
Okay, so we've got 5 cases prior to 2020, and those are either set at SOA or they're, I guess, set for an ISC.
Correct.
Okay. So we're very, very close to getting rid of all pre-BHEC cases. And just as a reminder, or this kind of made me remember, my tongue tied this morning. It jogged my memory about something. Brenda, how many boxes, when BHEC first started, we had like, I don't know, we had over 1,000 boxes of just archived records between what was stored at TSLAC and what we had in-house. How many boxes do we have left out of everything?
Daryl, when we started and what we got added to is approximately about 1,500. We are down now to 122 boxes left, and those are at the state library. Each week I request 10, and between the admins, Cody and myself, we try to work through those each week. And enforcement, they had 70 and they are down to 35. So we have less than 200 boxes at the state library, which saves the agency money as well.
Yeah.
So impressive.
The admins, really a lot of staff, but the admins in particular kind of deserve a hand there because they have moved mountains to get all that stuff scanned. I mean, I've watched them wear out scanners, so they've done a really good job at it. But anyway, I'm very pleased to report that we are just almost fully digital. On everything.
Wonderful.
So that's a big win for us. Let's see here. Another good thing on the enforcement report is, we're down to, this report says 467 pending complaints. It's actually, aren't we flirting with the 300s, Patrick?
It was below 410 last time Alfonso checked. So I think it was close to 300. We were like 405 or something like that.
Yeah. So again, that's the investigators and the staff attorneys, barreling through all this stuff, getting it taken care of. So again, that's just, we're doing really good. I know it sounds kind of self-indulging to say that, but I'm pretty proud of the staff for doing it. All
You
right.
should be proud. And furthermore, that's what the state of Texas and the citizens expect of us. So bragging counts. It's a true accomplishment and why we're put together. It's it's like applying for a job. You got to brag a little. Thank you. Thank you. And thank all your staff.
Yeah, Chair Canseco, I agree with you. Daryl, I would say that the success we're seeing in the numbers is indicative that the BHEC theory is working as intended.
Yeah, I agree. I think the machine is working exactly like what they wanted it to, what they designed it to. The next item up is going to be, let's see, what did Alpha? Okay, we got kind of I've included in your packet, moving on to the SIPAC issue under the informational topic heading. SIPAC kind of sent us a report card. Patrick, I'm going to let you speak to that. There was one area where they said, hey, you're, I don't know, I don't want to say deficient, but can you kind
Yeah,
of.
the one issue is they publish their rules and then we put links on our website to those rules so that they can comment on them. Much like people comment on our rules, they comment on theirs. We had been publishing those previously. I don't know where the disconnect was because I know we had put the links on our site whenever those rules had gone up. So I need to reach out to Janet, the executive director, just to get a little bit more detail on that. But that was the only thing that they said was potentially not in line, that was the only mark on our report card, I guess, that we got.
Yeah, and I looked through my emails. I couldn't see where I had received anything to post it, but Microsoft's search feature isn't quite as user-friendly as my old Gmail was. But anyway, we'll get that. We'll visit with Janet over at SIPAC about that and see if we can get that cleared up.
Hey, Patrick, I got a quick question for you. I noticed South Carolina's not on there anymore. Did their legislation fall through? 'Cause I remember
Uh,
that I thought they were kind of in the works, and then now I don't see it at all, like listed as. And
They
sorry,
might be. Yeah, they might be pending. I'm trying to remember all the list of the different states.
I thought y'all admitted one of the Carolinas at the last SIPAC meeting.
Yeah, I know I remember we reviewed 2 states and I can't remember what they are now. The problem is some of their legislatures would enact the SIPAC legislation, but they would make changes. And then we would have to get legal opinions from SIPAC attorneys to say, is it substantively different or is it a non-substantive change and we can accept it? And it may have been one of those where they made a substantive change and they didn't, the SIPAC commission did not admit them. I can't remember exactly. South Carolina might have been one of those that they did that. Not sometimes if that happens, they have to go back and amend their legislation to match exactly.
Dr.
Got it.
Cartwright, I'm looking in ASPPB's newsletter and it says North Carolina is a member of SIPAC, so.
yeah, North Carolina, I know is good. I just remembered South Carolina was kind of in process, and then now, like, that must be exactly what Patrick's saying. They probably didn't have things in line correctly, and I don't know if they're going to go back to square one or not. But I was just curious because I didn't see it on here at all, so I thought maybe something happened.
Yeah, you're correct. They're not a member right now. I know we've reviewed several states. I just can't remember. I'm guessing South Carolina must have been one of those. I just can't remember if that's the right state or not.
And then with regard to SIPAC as well, I included the ASPPB's newsletter. The only reason I include that for the council is in it, they always list the number of licensed individuals who have the APIT or the TAP, which is the TAP is the temporary in-person authority to practice, and APIT is the telehealth component that allows people to telecommute into Texas. There's 7,200 individuals now eligible to deliver telehealth services into Texas. Now, some of those will be Texas licensees in that number, but the vast majority, in fact, I would be willing to bet that there are more individuals eligible to deliver telehealth services in Texas under SIPAC than there are Texas psychologists. So my point being is the money that we spent to get SIPAC enacted and what it costs the council to participate in SIPAC is a pretty good return on your investment when you more than double your licensee population in the state or eligible to deliver services in the state. So and that number is only going to continue to grow. So as more states join, so I just point that out there to, if anybody's curious to know, is it growing? Yeah,
That's fantastic. That's fantastic.
Yeah. And that's it on SIPAC. The next issue up is I just wanted to give an update on our reciprocity discussions with Oklahoma. I included I gave y'all just a look at the draft agreement that Patrick and I have been working on. I've talked about this with Psych Board, but I don't think I've ever brought this up with y'all. It's been a while back now, but the Psych Board had asked me, hey, start kind of exploring our options for reciprocity with other jurisdictions. The Psychology Board has a statute that gives them express authority, or really the council express authority, to enter into reciprocity agreements for psychologists. And so I started shopping around, and one of the places I always look is our neighboring states: New Mexico, Oklahoma, Arkansas, and Louisiana. Well, Oklahoma, New Mexico can't do it. Oklahoma wanted to do it, but they didn't think they had the statutory authority. Long story short, we kind of let that discussion die because they didn't have authority. They reached out to Patrick and I again the other day and said, hey, our folks want to do it now. But we're going to have to go get the authority to do it. Can you draw up an agreement, something like what you think it would look like? Just give us a draft so that we can take it back to the board and the legislature and see if we can get authority to do this. So that's what you're looking at here. That's not a final agreement, so don't panic or think that it's done, but I feel like that's probably pretty close to what it would look like a draft agreement would. But just to kind of give you a heads up, we're in active discussions with Oklahoma to see if we can get a reciprocity agreement with them for psychologists, which that makes getting licensed very, very easy and very, very quick. I'm leaving to go to the ASPPB meeting today. I'm going to try to get with Arkansas when I'm up there and see if they would be interested in doing something similar. Louisiana, I wish we could work something out with them, but Louisiana has an oral exam, and I don't think we'll ever be able to get an agreement with them to where it would be as favorable for our folks as it is for theirs. I don't like entering into reciprocity agreements where our folks get the short end of the stick and another jurisdiction gets the better end of the stick. It needs to be kind of split down. It needs to be equal. It needs to be, fair for both sides. And so I don't want to put our folks in a bad spot by making them do more stuff to get licensed under quote unquote reciprocity than what another jurisdictions would have to do coming in. So I don't think Louisiana will actually be on the table, but I'll visit with their ED again at ASPPB just to make sure. But I will run the traps on Arkansas and see what I can get there. So any questions about that? I feel like probably you guys will have to sign off on that. I think we'll probably have something by next year, late next year. We'll be able to actually finalize this thing, get it finalized, assuming Oklahoma, the legislature goes along with it, which the individuals that we were talking to, they were optimistic that they thought they could get something done with the Oklahoma legislature. So we'll see. But if any questions on that?
Very nicely done.
And then I've got an article in there. I'm not going to go into it. It's just the raising barriers on licensure. The only reason I put that in there is just kind of keep it in the back of your mind. This kind of stuff is constantly going on. That doesn't even really apply to the healthcare, what we regulate, but that same type of mentality will translate over into our field. So I always keep that kind of stuff on my radar because you never know when mission creep is going to bleed over into our regulated area. And then lastly, just to give you an update, our database, we underwent a major upgrade starting last Friday. And then everything is back operational today. The public probably won't notice much of a difference on what we call the VO side, the public facing side. There's some pretty significant changes though on our side from the way staff view it. One of the things that we now have that we did not have before is more of a workflow type system. So that should help us on our efficiency internally. And then I think we've also, on the public side, I think we've also changed it up so that when somebody opens an application and they're submitting their documents, I think instead of before they were limited to just uploading documents on that first time. And then if they wanted to supplement it, they had to email it to us separately. I think now they can continue to upload into that application without having to email us. So that's going to cut down on just the number of emails that we get and have to deal with, because then you got to associate that document with this application in the system. Whereas now the applicant can just upload it themselves. So again, that'll help with efficiency. It's going to take us, this was such a big upgrade. There's a learning curve in it for staff. And of course, Jenny has been, working her fingers to the bone on this to make sure that it gets up and running. So I'm trying to kind of go leave her alone because she's got her hands full making sure this thing runs smoothly. And that's a big task. That's it as far as the informational items on the agenda. I'll take it back. We had the standardization committee, the report from the standardization committee. The standardization committee is still currently looking at we've got a general concept of supervision that we want to try and take to the individual boards and see if they're willing to go along with that. The difficulty that we're having at the staff level is translating that concept into actual rules at each of the boards. And the problem in that is each of you, the way supervision is interwoven in so many of your rules, it's major surgery to do this. And so Tim and Patrick and I have really kind of been pulling our hair out, trying to figure out how we're still trying to figure out how we're going to do it. We know what the committee wants, what the concept is. We're really struggling with how to do it. And so we're still working on that. The standardization committee will meet again in December. So, hopefully we'll have some ideas and some battle plans to take back to them at that point. But that's where we are right now. The committee's not sitting idle. They are working. We're back at it again. So, and then of course, you guys know that session's about to begin in January. We will start the 88th legislature. So that's gonna chew up a lot of time and attention. I've already been having meetings with state reps and senators and having to go over to the Capitol. So it's shaping up. It may be a pretty busy legislative session. I think mental health is going to be high on the priority list for the legislature. And so when that's the case, you can pretty much count on people are going to be calling us for resource, serve as a resource. And so we got to be ready to respond to that, which means some of you may be tapped as well. So just kind of keep that in mind.
Actually, that's why I raised my hand. What can we do and what should we not do as members of the council?
Well, I think the best thing you can do is always be amenable to taking calls from legislators whenever they, it's one thing for me to go over there. I can tell them what it's like, the pros and the cons of an idea or a concept from a staff perspective. But I'm not the one that was appointed by the governor and confirmed by the Senate to make the calls. And I think sometimes you need to be ready to visit with people, be open to visiting with legislators, regardless of, whether they're your legislator or not, and just make yourself amenable and available if you can to them, because, I typically don't hand out y'all's contact information without getting your permission ahead of time. But for a legislator, I probably would just throw it out there without
Sure.
clearing with you.
We can
And
give
then
them everything, including the dog's name.
Yeah, and then I'd call you afterwards and go, hey, you may be getting a call. So
Sure.
just understand that. I don't hand your stuff out to the public or anything, but I do to the members of the legislature.
Darylyn, one thing that has helped me in my personal career when we're ready to talk up what the agency's accomplished, we've been up, for 4 years now? Has it been 4 years?
2020, I think 3.
3.
Yeah.
So we've accomplished a lot in 3 years. Would it be possible to prepare a bullet point list? What are our highest needs, our biggest accomplishments, and the impact that we hope to provide? I think that those kinds of bullet points help us. We get a lot of information, not just at the meetings, but in between when you're sending us reports. But your content expertise would help us to have that at hand. And then we can add in our own, the things that are personal points of pride or something like that. I think that would be really helpful to all of us.
I think I've probably already got something like that drawn up, because I do something similar like that in my testimony to the House Appropriations and Senate Finance Committee. I do stuff like that so that they can kind of see, hey, here's what they've done. Here's the metrics that they've hit. So I can do that for you and just put out a talking points sheet for you.
That would be great. And I hope the members listening understand that this is the first independent agency to be stood up by the state in 11 years?
Yeah, at least a decade, at least.
So we're doing a heck of a good job. Thanks to all of you. And thanks to those participating who take the time to listen to these meetings and speak. Go ahead.
That's all we have for the informational. We're ready to move on to the action items.
Before we dig into number 4 on action items, we did call an audible and we moved 4C, as you can see in the italics. For continuity, we've moved this item down to 7AI. This is the discussion on school psychology. So just please make a note of that. We're only going to tackle 4A and 4B right here. Okay. Daryl, number 4A.
Okay, I'm gonna, basically what 4A is in your materials, you've got a decision or a recommendation that's been handed up or brought up by the LPC board. It's one of their licensees. It was a case that we'd taken to SOA. The ALJ entered a finding that there was a violation and ultimately recommended revocation of that individual's license. That matter was then heard by the LPC board, who assessed that the appropriate sanction should be revocation. And that matter is now being brought up before the council. What I'll do is I'll let Patrick, if he wants to add anything to it, we can do that. And then otherwise I'll see if Ms. Clement and her client wanted to speak to the council before it considered this matter? Patrick, did you have anything?
No, I don't really have anything else to add other than most of it's laid out in the proposal for decision from the ALJ. There's an amended one that lays out the findings of fact and conclusions of law, and then the proposed final decision that was voted on and recommended by the LPC board recommends adopting all those same findings of fact and conclusions of law, which ultimately would revoke her license. But I didn't, unless there's specific questions, I think it's pretty well laid out in those documents.
Okay, all right. Ms. Clement, if you are out in the audience and the attendees, if you would like to speak, or Ms. O'Connor, if you are here without Ms. Clement, you would like to speak, just raise your right, or not raise your right hand, but raise your hand to the raise hand function, and I'll let you speak with the council. We had received word that they did not plan to speak, but I wanted to make sure. Yeah, I'm not seeing Ms. Clement in the list. Okay, doesn't look like we have anybody. Nobody wishing to speak. So what we need now is if y'all need to discuss it, you can, or if you're ready to vote on it after reviewing all the materials. I know it was very voluminous what we sent you, but it's the full record. We need a decision on whether we want to adopt the recommendation to revoke the license.
So it'd be a motion to adopt the final decision in order to have
Yes.
Chair Canseco sign it.
Yes, sir.
Second, am I allowed
So
to
moved.
second?
Yes, you can second, Chair Canseco.
Okay, is there any discussion now that we have a motion? Okay, hearing none, at this time, we will go ahead and take a vote on whether we will accept the final decision and order as proposed, revoking the license. All in favor, please raise your hand so that we can see it. And I believe that was unanimous.
Okay.
So, yes, the decision is upheld.
Okay. Chair Canseco, we'll transmit that order to you for your signature, and then you can just transmit it back to us.
Thanks, everybody. Moving on to action item B. This is going to be led by Mr. Francis, so I will go ahead and hand it off to him to start the discussion.
And at this time, I have no discussion on this item. Thank you, Acting Chair.
Okay. Did you have any questions, or did any council, did anybody want to ask anything of Mr. Francis, or we just gonna put this on hold for now?
The thought was, after reviewing the material that was submitted this last time by Executive Director Spinks, the agency is functioning smoothly. I think the numbers are where they should be. I don't see any discrepancies that really warrant discussion. I think we can always look at how we can better scale, but at this point, nothing comes to mind. Thank you.
Thank you, Mr. Francis. As I mentioned, item C got moved to agenda item number 7. So we're going to go ahead and move on to number 5, rulemaking for the council. Okay, Daryl.
Okay, the first or the only rule up for proposal is 882.42. The purpose of this proposed change, Patrick and I have worked on it. What we realized is when we were reviewing the basically the criminal history eligibility rules, they focus mainly on Texas statutes, and we know that the intent is also to capture substantially similar federal, Commonwealth, a variety of other jurisdictional penal code offenses or penal offenses that equate to what we equate to a Texas offense here. And so we just want to make sure that we're giving full effect to what kind of what the boards and what the council had originally intended. And so this change is meant to do that. I don't want us limited to only being able to sanction or deny somebody a license or vet their criminal history because they got a federal child pornography charge instead of a child pornography charge under state law. We want to make sure that we're capturing all the criminal histories, and this change is what allows us to do that.
Need a motion to propose?
Yes, sir.
So moved.
I'll second the motion.
Thank you, Mr. Brumley. We do have a motion and a second. Is there any discussion regarding the proposed amendment? Okay, hearing none, we will go ahead and vote on accepting the proposed amendment. The 882.42. All in favor, please raise your hand. And that is unanimous. Thank you.
The next item is going to be 885.1, which is the fee rule, and it's being considered for adoption. It's kind of self-explanatory. This is the product of the Fee Review Advisory Committee. I just want to issue a reminder mainly to the public. If the council votes to adopt this rule today, it will not become effective until the fee reductions will not become effective until September 1st of 2023. That was done for a particular reason, and that reason being because the fee reduction will cause a reduction in revenue to the state. We wanted to make sure that the powers that be, the LBB, the House Appropriations and Senate Finance Committees, all those people that review the revenue and rely upon revenue to make statewide budget projections, had an opportunity, if they felt like this revenue reduction was going to be detrimental to the overall state budget or some component of it, had an opportunity to visit with us and ask us to reconsider it. So my point being is, even if the council adopts it today, I need everyone to understand that the reason we put the effective date out so far is to give officials the opportunity to come back to us and ask us to reconsider for whatever reason that they deem appropriate. So I haven't received any real pushback or anything on the rule. I've had to answer, Jenny and I've had to answer a few questions about it, but nobody has said, hey, pull the plug on that. But just understand that could still happen. I just want to try to manage expectations here.
Acting Chair, I make a motion to accept the fee proposals as presented.
Thank you, Mr.
Second.
Thank you, Chair Canseco with the second. Okay, we have a motion and a second. Is there any discussion regarding the adoption of the fee reduction?
I have one question, and this comes from, it's not noted in here, but at a recent conference I was at, there was several questions brought to related to the fee for the criminal history, the cost of getting that criminal history done before you apply for licensure, where it had been $50 and now it's $150. Daryl, is that something that we could look at for this, or is that a whole different can of worms?
Well, you could look at it here. The problem with that is that the fee that we have right now is based upon the amount of work and time that goes into those particular evaluations. They are not easy evaluations to do. And so they are very time intensive, and not just at like what I call the line staff level, but they take a lot of the staff attorney's time. So
Okay.
I don't feel like a reduction is warranted there. The criminal history evaluation is actually a tool that should be used before you ever go into a training program. That's what it's really designed for. And so that you don't waste your time and money going through a training program for something that you don't even qualify for licensure for.
Right.
And so when people go through the training program and then use it and sometimes, complain about the cost of it, I'm like, that's really something you should have done on the front end rather than, do it on the back end. So,
Well, that information about the complexity of doing one helps me answer questions now that I didn't know how to answer before. So that's, I didn't know why it went from 50 to 150. So
Yeah.
that explains that, and I'm fine with that.
They take a lot of time to do, those criminal history evaluations do.
Okay. All right, that's the only discussion I have on this topic. We can call for the vote.
Is there any further discussion? Okay, hearing none, we did have a motion to adopt 885.1, the revised executive council fees. All in favor, please raise your hand. And that passes unanimously. Moving on to agenda item number 6, rulemaking for MFT. I'll hand this to Ms. Smith.
Let me unmute myself. I think the biggest thing is to try to explain, only because I was confused by it. So I want to go to the proposed rule 808.202-5-year LMFTA. It's really just a language. And so if an LMFT associate has been working on their licensure and they haven't finished it within the 5 years, 60-month thing, it won't just be renewed automatically. They can't just renew it. They have to go back and reapply. Now, that does not mean that they will lose their credits that they had accrued, but it just means they have to go through a reapplication piece instead of a renewal. So it's kind of semantics. Don't ask me why. So that is what was asked kind of by staff. Then to continue just to renew, that they need to go to it. And then their clock starts again for their 60-month time. Does anybody have any questions on that?
The one thing I would add to it is we currently have a version, some proposed changes to 801.142 already out there in the Texas Register. We have taken those changes and incorporated them into the version of the rule that you're looking at there in your meeting packet. So if you guys approve this, what we'll do is we'll withdraw that, and then this version will encompass both the change to the 5-year license and the changes that were already proposed. So you're not losing, and they were just some typos too, if I'm remembering right.
Right. It's just a semantics thing. It's not substance.
Janine, though, do you think that the language is clear now? Do you think it could be made more clear? Because that's the kind of thing that could trip you up in a second.
My personal opinion, I think it could be clearer. I had to abstain on voting on this. We just met last week and I actually abstained when this vote was taken. The vote was passed, the motion got passed, that it was adopted. My personal opinion, I think it could be clearer, but I think I'm nitpicky. So I have to bow to the consensus of my board that they felt like it was all right, and the motion did pass to adopt it as written.
Thank you.
I will say this is how the LPCs do it, and it hasn't been problematic in that regard for the LPCs.
Good. Thank you.
Anything else that you wanted me to go over with this? I kind of lumped it all. Proposed 801.261. It's just changing. So like exactly what Daryl was talking about. When you open it up, you can see that what we did is that we took out the 15 hours of continuing ed for an LMFT associate, because they're already undergoing once a week supervision with their supervisors. So we felt like that to add in more and have to count it differently just was undue burden for staff. When I first read it, I thought, does that mean our associates don't have to do any continuing ed? But the reality is they're already doing once a week. And that is something that our board is not willing to give up on our 4 hours a month. We don't want it lumped like LPC does. We still want all of our associates to do a once a week supervision unless obviously they're out of town or there's an illness. It says specifically, except for extenuating circumstances. But because we deal with families, we deal with couples, waiting 2 or 3 weeks to meet with your supervisor, that's not good enough. So we still want to keep our supervision once a week. And because of that, we felt like we were already asking them, they're already undergoing different things, working on their techniques and brushing up on things like that, that they're already pretty much doing their 15 hours. So they won't have where they have to count that CE until they become fully licensed, and then they go back to the 30. Anybody have any discussion or questions about this that I can explain further? Daryl, did you want to add anything, or George, did you guys want to add anything to that?
No, you did an exquisite job as always, Janine. I was just gonna ask Acting Chair Howbauer if he would accept a motion to accept these proposed rule changes as presented.
Yeah, I believe that we can put one or letter I, double I, and triple I all together. That's correct?
You can do 1 through 3.
Yeah,
Yes.
1 through 3.
Yes.
Okay, so Mr. Francis has made a motion. Do I have a second?
So second,
Mr. Chair, one clarification on the motion, y'all are okay, and the motion contemplates withdrawing the existing proposed language for 142 because it's been incorporated into this change.
Understood.
Okay.
Okay, we do have a motion and a second. Is there any discussion regarding the motion as presented? Is everyone clear on Daryl's clarification there? Okay. All in favor of accepting the proposed rule changes to 801.142, 801.202, and 801.261, please raise your hand. And that is everybody. Thank you. We'll move on to 6B. This is possible adoption of a few new proposed rule changes. So again, Ms. Smith, are you going to lead the discussion on this?
I can, but I would like for Daryl to kind of speak to this as well, because I think he has greater ability to make himself clearer than I do.
All right. Go ahead.
Ha, 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 ha. No.
There goes that bus over me again.
Twice in 1 week.
know
This is a record for me. I'm sorry.
I know it. 801.2 is a definitional change that the MFT board, what they found out was that they didn't have a clear definition for direct clinical services, or what they call, I guess, relational hours. And so this is the MFT board. They've developed and proposed this definition. There were some public comments on this, one for, I think, one kind of quasi against. I can't say that anything was really against it. But the board considered all of that, and their recommendation is to go with what was originally proposed, though. And of course, I don't see any problem with it. 801.43 is a professional relationship. It's where the MFT board is basically copying what LPCs and psych already do in that they require their associate level folks to identify themselves as such and make sure that the public knows how to get a hold of their supervisor should they need to. That's definitely something that needs to be done, I think. No comments were on that. Now, I will say we'll probably have to do some education efforts on that at the staff level, maybe use the insights over the lunch hour type training sessions to educate the public on this new requirement. The good thing is that the board I think they put an effective date sometime next year on it. So it's not something that just kicks in automatically that's going to catch people. We'll have some time to educate everybody up on it.
Also, I wanted to also point out that one of the other reasons why we did it, like Daryl was saying, the LPC board already says this. So when you have your sign off on your business cards or on your signature thing for your emails, it was already that said supervised by so and so and so and so. And so people that were already duly licensed LMFT and LPC were already doing it. And it came to our attention, it seemed like it was a little wacky to have some people already doing it and some people didn't do it. And so that's why we just wanted to go ahead and make it to where it was across the board. And that was the reason for that change.
The next one is 801.302. It's really just it's kind of a clarification. We're just trying to take multiple references to basically the same thing and consolidate it down into one rule. This was something that the governor's office had identified, and they were just like, hey, you could probably tighten this rule up, just make it a little bit easier to read and probably make it shorter. So substantively, it doesn't change anything. It's a cleanup. And then 801.305 is, again, there are it's a major cleanup of the schedule of sanctions rules. And it just makes it follows the simplified chart format that everybody is moving to. Since the target audience for these things is the attorneys and the respondents and the ALJ, we need it in a format that's very easy to use for those. And so that's what the MFT board is doing. Because
Let's make things easier for the lawyers.
that's right. We
Yeah.
need it as easy. We need it as simple as we can get it. And that's it.
Mr. Francis, oh, go ahead.
I was just going to offer a motion if there was no discussion.
Okay, we have a motion to adopt the 4 rule changes. Do I have a second?
So second,
Thank you, Ms. Smith. We have a motion and a second. Is there any further discussion regarding adoption of these proposed rule changes? Okay, hearing none at this time, we will vote whether we wish to adopt 801.2, 801.43, 801.302, and 801.305. These are for adoption. All in favor, please raise your hand. And the 4 changes are adopted. Thank you. All right, let's go ahead and move on. Mr. Belemowitz, I think that you will be heading up the discussion on behalf of the Psychology Board.
You bet. Can everybody hear me okay?
Yes.
Perfect. Okay. Thank you very much. So what we have is a proposed rule dealing with school psychologists. This idea of what do we call school psychologists? I'm doing it right now. I'm referring to them as school psychologists. If I was being correct, I should be referring to them as LSSPs. I've literally been in our meetings where PhD psychologists are referring to them as school psychologists, and it's historically it's been a little bit of a point of contention. But this discussion came out of the special meeting that we most recently called, and it's to me it's logical. There's a lot of confusion in the public's mind about what is an LSSP, and when you can call them simply a school psychologist and call them what we call them, on a day-to-day basis. And also across the United States, that's what they're called. It's a very simple change, although statutorily it provides a couple of different nuances in terms of how the code refers to them, which is why we have this draft opinion, request for an opinion from the Attorney General on do we have the statutory authority to do this. I trust that you guys have read this, but for the edification of the public here, it seems to suggest, the law seems to suggest that we have the latitude to change what we call them, although that the law actually does require us to issue the LSSP license, what it's actually referred to. I believe we've got the latitude to do it. Daryl, I'm gonna ask you to chime in right here. He and I have had a couple of conversations around this. I'm not sure it's necessary. This is you can correct me, Daryl, if I'm out of line on this or wrong. This seems like a belts and suspenders thing if there's any question. But Daryl, I'll let you weigh out to the board the pros and cons of the opinion letter as well.
Yes, Chair Belemowitz has stated it ably. The opinion letter is simply a belts and suspenders approach. Because the statutes the statute in 501 says we issue the LSSP. But that statute also refers to a section of the education code where these same individuals are referred to as school psychologists. And so that's the statute we're relying upon in order to say, hey, you can use that title. But as Chair Lemos pointed out, the license will still be the licensed specialist in school psychology. They will simply be allowed to use the title of school psychologist under this rule change. Now, one thing I would point out on the proposed rule that you have before you here, it says school psychologist or licensed school psychologist. Since we put this in your packets and since the board met, I visited with stakeholders on that. There's some uneasiness about leaving the language or licensed school psychologist in there because the statute just in the education code just refers to school psychologists. So while I think we go ahead and propose the rule as it's written today, because that's what Psych Board sent up, I want to put this out there so that the public understands that when this comes back to the psychology board after comment, notice and comment, I am more than likely going to recommend to the board to strike that language or licensed school psychologist. Substantively, it won't change anything in the rule. LSSPs will still be allowed to use the title school psychologist. It's just, it removes any kind of grain of sand in the machine, if you will, that might rub people the wrong way. And if we can achieve kind of a compromise where everybody is okay with it, then I think that's probably the better way to go. But that's more I'm just kind of projecting what I think will probably happen in the future. And that's what I'm going to probably recommend to the board. But as we stand right here, right now, I think the rule should be, I'm going to ask you to propose it as it's written. And then I think we need to seek the AG opinion just as a belts and suspenders approach. And the good thing is if the AG comes back and says, hey, y'all don't have that authority, well, we can undo it. It's a no harm, no foul type deal there. But if I think the AG will come back and say, yeah, you can based on how the education code is worded. So that's why I'm not worried about going forward with it now, kind of simultaneously.
Yeah, with the name, I feel like the legislature, and this is why I could go either way on the opinion letter. I think that if the legislature really cared about what it was called, it would have referred to it by one thing and not have been saying two different things. So I can go either way on that, but this seems like, why is there so much discussion around what we call something? This is part of kind of a bigger discussion as well on school psychologists and what can we do to expand opportunities for people to enter the profession responsibly with good standards in a practical way that addresses, the needs of the state and especially our school kids. So I hope you guys will support this.
One other thing too is that it sounds like you have to have that NCSP to be able to call yourself a school psychologist at the LSSP level. That's correct, Daryl?
No, you wouldn't have to have the NCSP.
Okay.
That's only to call yourself a nationally certified school psychologist.
Correct.
And there was previously an AG opinion on that did say that they can call themselves a nationally certified school psychologist.
Gotcha. And then I think it's 48 states out of 50 are, at that LSSP or master's level. If they meet all the requirements for licensure within their state, they're called school psychologists. So, we're one of two states that don't allow it. I think Arkansas, maybe the other one, but, and I think it does eliminate some confusion in these ARG meetings. Hello, I'm a licensed specialist in school psychology. Well, what's that? It's just kind of, some of it's just terminology and avoiding confusion for families, for even some of the folks that are part of the education system, that, the school counselors, teachers, some of them really, honestly, it throws them off. So I've seen that from firsthand experience in being an LSSP and an LP. So I'm in favor of the change as well. And keep in mind, it doesn't change the scope of practice. A school psychologist will still only be able to practice within the parameters of a private or public school, and that would include charter schools as well. But they would not be able to practice outside. And so I think those guidelines need to be clear to the public, and they need to be upfront about that. But just something to note.
Dr. Cartwright, where are you on the soliciting the AG opinion?
Honestly, I can go either way on it. I mean, I guess I'm, after reading it, I honestly, I'm kind of like with John. I mean, I can kind of go either way on it. I don't think it's necessarily, something where we have to go in that direction. But again, I mean, I'm for the school psychologists at that level to be able to call themselves school psychologists. So whatever that means.
The only other reason I said we go either way on it. If I had to pick, I would be in favor of it. Only because if somebody wants to throw rocks at this in terms of the statutory authority, I think this is candidly one of the easier opinions that the opinion committee will probably have to write. The belts and suspenders approach, if again somebody wants to throw rocks at, you can't call it this, I wouldn't mind having that opinion, because I think it's pretty clear that we do have the authority to do it. It wouldn't hurt to have them agree with that.
John, are you anticipating lots of rocks being thrown at this?
Not really. And that's actually a good question. Because historically, this has been, to me as a non-psychologist, strangely contentious of what we call this. And again, and colloquially and informally, this from many of the same people in same places where people would have thrown rocks at, no, you can't call it a school psychologist. Actually, like in conversation, refer to them as school psychologists. When this one of the ideas coming out of our special meeting, put it up on the table, I actually expected probably a little bit more pushback on it. It hasn't materialized. I think that everybody sees that this is I don't know. We discuss some really contentious things sometimes. Dr. Cartwright, you can chime in. This hasn't really been one of them.
Right, it hasn't. And I mean, I think there's a lot of agreement on our board. I mean, I do think that keeping the LSSP license is necessary. I mean, that's from a licensure perspective, but we're just talking about really a title of practicality and basically clearing lines of communication and avoiding confusion to the public. I mean, yeah. So I don't think the intention is to try to get rid of the LSSP license or anything to that nature. It's more or less just clearing the language and making communication better and avoiding confusion. So
yeah, and if anything, I feel like it expands opportunities for the LSSP license, the school psychologist job. I think it's one of the questions I've asked myself is when we've looked at this, when we're trying to, we have a mental health provider shortage in this state. What do we do? I mean, we're limited in what we can do, but when I'm thinking about an 18-year-old high school graduate considering his or her career options, you have to be able to conceptualize it. And so Top Gun, the movie, came out, and so my boys can very clearly conceptualize what it means to go to the Navy and to be a fighter pilot, because they can see it. Getting and inspiring somebody to enter the mental health profession, if you can, school psychologist is something that 18-year-old John could have very easily understood. LSSP, I don't know, that's 4 letters. I don't know what that means. If we're trying to do something on the margins, this is a step. To me, it's one of the easiest things that we could do to continue this conversation of how do we inspire and get people into this profession.
There's an added benefit to allowing them to use the title school psychologist, because LSSP doesn't always translate real well into other languages.
Bingo. That's
Right.
actually, I'm glad you mentioned that.
Really fast. It's like a tough, so.
Daryl, I'm glad you brought that up. That's something that I have heard in the discussions, especially with people who are dealing with non-native English speakers, sometimes even parents who don't speak English. And it's like, well, who are you? What do you do? LSSP. And then you explain, I don't know the Spanish translation for school psychologist, but it is a clearly understandable thing to everybody. When you call them a school psychologist. So,
and sometimes in Spanish, if you add the word licenciada, which I guess directly translates to the word licensed, that often takes care of it. So just as title, instead of saying señora or doctora, which are obvious, licenciada could take care of that in terms of translation. But it means a professional with a degree.
John, to your point, having a 17-year-old junior in high school daughter who wants to be a school psychologist, she never goes around with the initials that would apply to that, but she always says she wants to be a school psychologist and work with children. And so to your point, I think that is just spot on.
Yeah, let's let her be a school psychologist.
Yeah, I like it.
Move passage on both adoption of both the rule and the I would move for the opinion letter as well.
Right, and I mean,
Is
it's
that
not
your
like
motion?
we're an outlier here. I mean, 48 other states do it, and the title is within the national certification, a nationally certified school psychologist, even at the LSSP or master's level. So I mean, it's not like we're throwing some huge curveball here. I mean, it's pretty much status quo throughout the nation, to be honest with you.
Okay, Mr. Belemowitz has made a motion. Will you state that one more time, including?
Move adoption to propose the rule and to seek the AG opinion.
I second.
Second.
Okay, I got the second from Dr. Cartwright. Further discussion, specifically, Patrick, if we sought the AG opinion, how much longer does the change take, since we'll be waiting on that? Are we looking at an additional 6 months?
Well, you can take several options. You can wait for them to issue their opinion, but we can go ahead and adopt while we're waiting for the opinion. And if the opinion comes back and says, no, you shouldn't have done that, then we should certainly start the proceedings to repeal this. But so I don't think it'll necessarily hold up the rule, but obviously the timing of it is up to you guys and the board. You can wait for it, but the problem with that is they could, get it to us really quickly. But like we have another pending Attorney General request with them, and it's gone, I think, past 120 days, right, Daryl? So
It's up to 200 and something days, I think.
right. So I don't know that I would say wait for that opinion. I would say just we've requested it, and if it comes back in the negative, then we certainly need to take action, because I believe we're on good footing. So I don't think it should slow down the process, is essentially what I'm saying.
Okay.
Yeah, I'm not planning on slowing anything down. I think that it's an invitation for the AG to, I think, write probably one of the easier opinion letters that's probably going to be in their queue if we request it.
Okay, well, I view it as this is what the psychology board would like to do. However, in the interest of belt and suspenders, we are seeking confirmation from the AG that the proposed change is acceptable.
Right.
Okay.
If it makes you feel any better, either Patrick or I have to sign off on the fact that we think you have legal authority to do it. So it's really us putting our name on the line here with you. We're just as much in it with you as y'all are by voting for it.
Well, do you think it's necessary?
I do. Well, I don't think it's necessary. I think it's a good idea. But I'm telling you right now, I'm comfortable enough signing off on it, saying you have legal authority to do it, even without the opinion right now. I'm just telling you, let's do it anyway, just in case.
We're proceeding, but we're essentially asking the AG to check our work.
Correct.
And Daryl, it
I'd
wouldn't.
like to call the, oops, sorry, I'm sorry. I'd
I was
like to
just
call the
gonna-
question is what I was going to say.
Did Brenda have something?
I was just gonna say that if it does go forward, it wouldn't go before BHEC again for adoption until the 31st of January.
That'd be the soonest it could get before BHEC.
Okay. Is there any further discussion regarding Mr. Belemowitz's motion? Okay. Daryl, this is 465.38, correct?
Correct.
Okay, all in favor of the proposed changes to 465.38 regarding the terminology for a school psychologist, please raise your hand. And motion passes. Thank you.
Thank you, everybody.
And then we need the AG opinion too.
I made the motion altogether.
Yeah, but when you called the vote, it was just on 465.38.
Okay. Apologies. That Chair Conseco, you're gonna want to have to get me out of here as soon as possible.
No, I
I
remember.
neglected to mention that we were also seeking the AG opinion regarding the proposed change. So a separate vote, all in favor of seeking the Attorney General opinion on the proposed change, please raise your hand again. Also unanimous. My apologies for that. Tell you what, do you guys want to take about a 5-minute break?
Please.
Is this a good
Yes.
time? Okay, I'll see you back at 11:20 a.m.
Okay.
All right, thanks, everyone. We are back in open meeting. I'll call us back to order at 11:26 a.m. Agenda item number 8 is rulemaking from the LPC board. A quick recap on this is these are changes to our CE requirements. Dr. Taylor, jump in on this with me, but this has been a long journey with our changes. They were back before BHEC proposed, I believe in our May meeting. And at that time, we had received a lot of written comment. And at that point, Dr. Taylor and I decided that it was our recommendation that we put the process on hold for a second so we could review the public comment that we've received. What we did when they got sent back down to the LPC board is we made a few key changes. First of all, we had added a requirement that our jurisprudence exam would be required. But then on further down in the rule where it made a list of what were the approved CE providers, there were a couple additions that were made. First of all, we were going to allow independent providers that have supervisor status. And then also it was a suggestion I think came out of another board regarding a hospital or hospital system. That was also added in under the approved provider list. That was a requirement of 50% of the CE hours. And then I think LPCs were the first one that put an effective date on this. And we added January 1st of 2024. So the other boards that are also tackling these, we settled on January 1st of 2024 for an effective date on this. So Dr. Taylor kind of add on to this, but I will say that we did listen on the comments that we received on this. There was a lot of concern that independent providers were being left off. And so what we did is we had a compromise rule change, and that allowed for anyone, a CE provider that had supervisor status was now included on that approved providers list, which I thought was a good compromise. I do feel as though the system that we have in place for the way rules are proposed and analyzed and the comments that we received, I believe that it did work in this time. We did receive feedback. And the rules as proposed today is a better version of what was originally brought up back in May. And I appreciate our professional members that took additional time to review this and make suggestions, and I appreciate staff that also had that came back to us and said, we've thought about it, and here's some ideas that we can make this thing better. And so what you have before you today, I believe, is a much improved version over what was originally proposed back in May. So Dr. Taylor, anything you want to add to that?
No, Steve, you got it, man. That covers it. I think
Okay.
it's a great step forward. It's good.
Yeah, we heard from stakeholder organizations, they like this new version, and so this is what you have here today, new changes to the CE requirements, and where applicable, it repealed a few rules that will now be updated in the new consolidated rule, correct? Okay, so any questions on that? That's probably more than you needed to know, but I'm proud of the work that the LBC board did here. We paid attention when people raised their hands and expressed concerns, and we went back and we made a better rule. And in my opinion, this is a better rule that you're considering here today. Okay. Any questions for us?
No, I'd like to approve it. I'd like to make a motion to approve it as proposed.
Thank you, Chair Canseco. Is there a second?
I second.
Thank you, Dr. Cartwright. Is there any discussion on the motion or the second? Okay, then the motion has been made that we approve the proposed rule changes to 681, 140, 141, 142, 143, 145, and 147. All in favor, please raise your hand. And that motion passes. Thank you. We do not have any rules up for adoption, so we will go ahead and move on to number 9, social work, and I'm going to hand this to Mr. Brumley for his discussion.
Okay, so we have rules proposed of 781-401 and 781-404 are very similar. They deal with the removal of, we call it the historically a person had to do their supervision for their licensed clinical social work supervision between a 2 and 5 year period. We're removing the 60-month, the 5-year outside piece of that. This doesn't really impact anything other than those within that are seeking the LCSW. So that's 781-401, 781-404 is it in a different place in the rule. So then we have 781-501 proposed, and it's very similar to what was just discussed. This amends the rule to add hospitals and hospital systems to the CEU provider section. And then the last proposed rule deals with allowing social work board to make specific changes related to licensure requirements, specifically due to a declared disaster. So those are the proposed rules for social work.
The one thing I would add, Chair Brumley, is on 781.404. Again, like we did for MFTs, there's already a version. There are already some proposed changes to that rule that have been published. And they have been incorporated into the text of the rule that you have there in your packet. So if you propose this, we will withdraw that proposed version that's already out there. And those changes will then be published again as part of this rule change package. So it's just an FYI.
Dale, just want to point out that 401 is also up for adoption. So the proposed version of this 401
Is next. Yeah.
is next. So
Yeah.
there will be some potential changes that'll be voted on, and then this is to be proposed after those adopted changes are made, I guess.
Correct.
So anybody have any questions concerning these?
Actually, Patrick, kind of you lost me there. So we need to vote on something else before we vote on this? Or are we doing, or I'm not sure I understood what you said.
You can take it in any particular order you want to. I wanted to point out is that if you look down in the adoption section in 9B, 401 is there, and there are some changes that will be adopted. And so this proposed version assumes those changes will be adopted. So, and it's being proposed with some additional changes, but we won't propose those changes until we adopt the changes
Okay.
that are in 9B.
Okay, sorry, thank you.
This is the rulemaking dance.
I hardly wait to hear the motion. That's my thing.
What I would recommend is carving, just don't include 401 right now. Just do a
Okay.
motion to propose 404, 421, and 501.
Yeah, and I would just say so moved, but I'm gonna let you do that, Brian.
I don't know, can I make a motion on my own?
Yes, sir.
All right, so I make a motion that we approve the proposals of 781 404, 781 501, and 781 421.
Second.
Thank you, Dr. Taylor. Okay, we have a motion and a second. Is there any further discussion? Okay, all in favor of the proposed changes as stated by Chair Brumley, please raise your hand. And passes. Thank you. Now, 9B, Chair Brumley,
Yes, so this takes us to those to be adopted today. So we have 781 304. This removes, I think they call it duplicative language that's within the rule. So y'all have that in your packet if you want to read that. Then we have 781 401, which we briefly just talked about, which is removing the 5-year immediately preceding the date of the application. Then we have 781 405. This is a typographical error within a rule that needs to be dealt with. 781 406 is again related to the 5-year requirement in another place in our rules. 781 803 has to deals with sanctions. It has to deal with the severity level within the sanctions. They're striking out some things and changing some wording there. I don't think, Patrick, it really overall changes the look of the sanction. It just cleans it up. Is that correct?
Yeah, that's correct. There's similar proposal that LMFT just did, but this kind of simplifies and it combines there used to be 2 suspension levels and now there's just 1 suspension level.
Right. And then the next 781 805 sort of puts it in a nice chart so you can see where they fall. And then the remaining, then the one that repeals. So if we adopt these, it repeals the old pieces of the sanctions is what's also within 781 805. And then the rest is just public comment. So I would ask that the board adopt the rule changes, 781 304, 401, 405, 406, 803, and repeal and replace within 805. And I put that in form of a motion.
Second.
okay, Chair Brumley made a motion, Mr. Francis has second. Is there any further discussion regarding the motion? Okay, all in favor of the adoption of the rules as stated, please raise your hand. Motion passes and those are adopted. Thank you, Chair Brumley.
And I will say, Patrick, with the adoption of that rule, doesn't that clear up a lot of those individuals that have been hung up at the social work board because of that 5-year window? So I
Yes.
know, I suspect licensing staff are watching this, so you guys now have a green light. Go ahead and if those people are otherwise eligible, let's go ahead and get them licensed.
Thank y'all.
And now we got to go back and do 401 up there, the proposed.
Okay, so back to the proposed rules, 781 401. I make a motion that we're now making a motion to adopt it. Is that correct, Daryl?
You're proposing changes to the rule that you just.
Okay. So I make a motion that we accept the proposed changes to the rule 781 401 as
second.
Thank you, Ms. Smith. Okay, any discussion on Chair Brumley's motion? Okay. All in favor of the proposed changes, please raise your hand. And that passes. Chair Brumley, anything else, or is that?
that's
Okay.
all.
Thank you very much. We'll move on to number 10, the report from our member boards. I will take you in the same order that we considered your rules. So let's start with our marriage and family therapists. Ms. Smith, do you want to tackle it?
Sure. Thank you so much, Chair, or Acting Chair. We met last week and had a great meeting. We do have a few things that we are going to be looking at legislatively wise. They're mostly statute changes, which would change some supervision things, but they are statute related. So we will be seeking a statute fix on that. We're also looking at, because our association, our national association, doesn't have a plan for reciprocity from other states. So we looked at what the difference would be on a universal licensure, on compact. And since we don't have that, we'll be looking at reciprocity between different states. The thing with reciprocity that we want to always make sure is that if people are coming in to practice, we want to have the same ability to go out. Just like Daryl had said earlier, we don't want to get in a situation where our licensees are at a disadvantage as opposed to allowing MFTs to come into the state. We want to make sure that we have the same reciprocity agreement so that we're not disadvantaged and all of a sudden opportunities for our licensees are lost. So we'll be looking into that. We'll be having our association is next in the spring. We'll be having that. And that's really it. We had a good meeting. Nothing big contentious, except for me. I was the fly in the ointment on several motions.
Janine, are you all kind of boots on the ground reciprocity, or more of like a site pack situation like what we have in the site?
We don't have the ability. Yeah, that's such a great question. We currently, our national group is not doing anything, and we don't have the ability for a SIPAC type of situation. So that's why we have to look at more reciprocity than SIPAC. I wish, I would love that, but we also don't want to be left behind because you guys are doing a great job and LPCs are doing a great job moving forward on things, and we don't want to be left behind where licensees decide, why get an LMFT license? So that's the big push.
Yeah.
Thank you for asking that, though. I think I covered our big hit things.
Thank you.
We are very pleased that we don't have anything tying up. We're really pleased that all of our cases continue to be super, super low. So thank you again to the staff for all the work that you guys do.
Thank you, Ms. Smith. Okay, Mr. Belemowitz, can we hear what the psychology board is up to?
Yes, happy to. So I'm actually leaving tomorrow. I'm going to be going to the ASPPB annual meeting, and I'm speaking actually on the panel maintaining licensure standards amid workforce demands, which is an interesting topic. The supposition of the topic itself, to me, kind of supposes an either or scenario. And I'm actually kind of excited to be talking about it, to share kind of what we're working on from the Texas point of view. I don't think that those things are either or things. I guess I'm anxious to see if in other jurisdictions that they're having this either or discussion. I've heard some things about there's pressure to lower standards just to meet workforce demands. I think that coming out of our special meeting after to just kind of look at what do we do to address the shortage. It's no secret we've been looking at our licensing standards, but the question is why are they there? Because there's so many of these standards that have just been there since the 70s, and it's actually part of what I'm going to be talking about is why. It's something we do in the manufacturing world, is ask why 5 times. That's something that actually came out of Toyota in terms of how they get to the root cause of things. And though I've rarely ever heard it in the open, but when I keep asking why, a lot of times it feels like we're getting to a point of, well, that's just what we've done. And in today's regulatory, environment, and today's changing legal environment with what courts are doing, that's not a good enough answer. And we need to be able to justify. And there's many cases where many of these standards are, I see the wisdom in them. I see the need for them. We've got to be able to, in the profession also has to be able to justify very specifically why, not to me, but I mean, because if we don't get it right, a judge is going to do it. So that's sort of the premise of how I'm looking at things right now, the things that we're going to be talking about on a national level. And kind of we're in the midst of it with looking at a lot of opportunities to increase opportunities for people to enter the profession through the school psychologist route. So those are things that I'm working on. I'll defer to Dr. Cartwright if he has anything he wants to add from his perspective as well.
I mean, I think you pretty much summed it up, John.
All right.
All right, thanks, guys. We'll a few things regarding what the counseling board has been up to. I wanted to point out to everybody. First of all, I would like to recognize 2 members of our board, Ms. Janie Stubblefield, a professional member, and Ms. Vanessa Hall, a public member. They took the initiative and put on one of these lunch and learn presentations. It took place on September 29th, and we had over 350 participants as part of this. I mean, it was just an incredible turnout. Credit goes to Daryl for continuing to encourage each board to host these things. And I had 2 board members that stood up, did the presentation, did a PowerPoint, and then hosted the discussion. And it was, I thought it was an incredible turnout. You never quite know who's gonna tune into this, but 350 was an incredible number, and it was it really, to the credit of Janie and Vanessa, did such a great job on it. LPC board is going to try to do these as often as I can get board members that are willing to step up and do it. Dr. Taylor coordinated our first one, and whenever they reach out to me or reach out to the staff and say they're interested in hosting one of these, they get my full support, and they get the promotion of the staff, and they're fantastic events. And I like to encourage our board to get out there as much as possible, and it's an easy way to do it, and so far we've been very successful. Second thing I wanted to mention, we have 4 professional members that are going to be on a panel presentation at the Texas Counseling Association Professional Growth Conference that's coming up in 2 weeks. It's going to be up in Dallas. We have a 1-hour panel presentation in the middle of the afternoon. Dr. Taylor's going to be part of that. I will be not on the panel presentation, but I'll be sitting with our board administrator in our booth that is going to be at the conference, where I'm going to try to reach out to as many Texas counselors as possible, introduce myself, see what questions they have, get some direct feedback on what they feel we're doing well, and maybe hear about things that they think that we could do a little bit better. But that's fine. I love getting out and meeting as many of the professional Texas counselors as possible, and it's a great opportunity to do it. And finally, it's interesting that we're talking about reciprocity and PACS. The LPC board at our previous meeting passed a resolution on why we believe Texas joining the Interstate Counseling Compact would be beneficial for Texans. That's the best way to put it, is a resolution on why we feel it has benefits. We wanted this to be a thing to where someday Daryl's going to be called up by a senator or a representative and asked, how does your board feel about membership? And the goal here was to say, our board likes it so much that they passed a resolution in support of it. Here's a copy of it. And we're trying to make Daryl's job easier. We're trying to show that there's great benefit for this state joining in the counseling compact. Hopefully it'll happen in the upcoming legislative session.
Yeah.
So, Dr. Taylor, anything else to add?
No, Steve, that covers, man, you covered it all. That's what we got.
All right, well, appreciate it. And finally, updates, social work. Chair Brumley, hand it back to you.
All right, thank you. So Sarah and I attended the NASW Texas conference week before last, I guess. Had a good interaction with the social workers of Texas that attended there, was able to update them on all the recent CE changes and sort of clarify some things. It was nice to do that in a face-to-face fashion again. We also had our meeting earlier this month. Thank y'all very much for clearing up some of the backlog things that we've had related to this 5-year rule. I know we have social workers that are listening today that appreciate that. We still, we had lots of questions about the data release that our licensure testing agency, ASWB, put forth. We had some good open discussions about that at the NASW conference, and that continues to be a topic of discussion around the state. I'm going to attend the ASWB Delegate Assembly next month, and that will continue as a point of discussion related to diversity and testing accuracy. Other than that, that's we're on board with looking at all the reciprocity things that we can do. And then finally, I guess, just to acknowledge that one of our, if y'all were paying attention to the news up in the Dallas area this last weekend, there was a nurse and a social worker who were killed at Methodist Hospital just in the general course of their job. So just to acknowledge the fact that healthcare workers out in the public are sometimes in dangerous situations. And that's all I have.
Thank you, Chair Brumley. I don't see Asia. I think she dropped off. Yeah, she's Ms. Smith. Go ahead.
You're on mute.
Go ahead and go to Aisha first. There were a couple of points, if you wouldn't mind to circle back with me after social work report. I apologize, but I want Aisha to have a chance to respond.
Ms. Rogers, is there anything else that you wanted to add there?
No, nothing else.
All right, thanks. Ms. Smith, we'll go back to you for your points.
I'm so sorry. Because I went first, I was a little brain dead. I did want to, when you talked about it, Steve, it reminded me, we'll have our MFT board, we'll have our lunch and learn, I believe this will be our second or third one. Our next one's coming up December the 2nd. So we invite anybody that's interested in that. We had a great turnout last time. And the other thing, I don't know if you guys on your other boards have run into this, but we're really trying to tackle what can we do to educate the public on the difference between somebody being licensed and somebody being a coach. Because when a license gets taken away from a licensee, there's a reason that it was taken away. And all too often we're seeing sometimes those people going ahead and going into coaching. And so we will be starting to put things on our website about what's the difference between a coach and a licensed professional. And this is just so that we can make sure the public continues to be protected against potentially unethical practitioners or practitioners that have had sanctions against them. So I just wanted to get feedback from you guys. If you have noticed this with any of your former licensees, or if this is a question or concern that you guys would have. And I appreciate any information that you think would be helpful to put in that to differentiate between a coach or a licensed professional. So thank you for letting me go back to that. I'm sorry I was brain dead in the beginning.
No problem.
I think anytime that a professional's integrity is put into question and you can clarify any member board, I think it's critical that we do so. Folks suffering from mental health or behavioral health issues suffer enough without having to deal with that lack of integrity as well. So I really appreciate Janine. I appreciate the work of your board, and I'd like to emphasize that if every other board is seeing something like that, that we nip that in the bud right now.
Thank you, Chair.
Okay, I think that wraps up the report from the member board. So we will go to number 11, agenda items for our next council meeting, which are we going to be virtual or in person?
We'll probably still be virtual at that time. January 31st will be the next meeting. They do have I sent y'all pictures. They've got the furniture in there, but the technology isn't set up to where we can do anything from those meeting rooms yet. So we'll probably still be in the same room where we are.
Okay.
Great.
Other agenda items.
One thing you'll start to see is bill filings. I'll start keeping you guys up to date once pre-filing starts, letting you know what bills have been filed.
Okay.
I'll let you know when that daylight savings time bill gets filed again. He likes to make fun of me for tracking that bill.
That's worth tracking. I mean, I don't have the stats in front of me. Apparently there's a whole lot of mental health episodes that increase at every time change, especially. So track it.
Yeah, that was my tie-in right there.
All right. No, that goes back to right when I joined BHEC. I asked Daryl to keep me posted on the bills he was tracking, and I was reading through it, and one was regarding the change to daylight savings time. So I kind of razzed him a little bit about why we're paying attention to that. But now I know. Now I know.
He's thorough.
Okay. Hearing no other suggestions for future agenda items, we will go ahead and go to number 12, public comment.
Okay. For members of the public who wish to give public comment, if you're watching online virtually via computer, if you'll use the raise hand feature, I will call on you. You will have 3 minutes. Mr. Hyde, our general counsel, will be the timekeeper. In fact, you can see your 3 minutes will be up on the screen. And then at the end of that, we'll mute you and move on to the next person. If you're calling in by telephone right now, I don't see any, but if somebody does call in by telephone, I will call on you last, and I'll have to call on each individual since they don't have the raise hand feature. Okay, starting out. We're going to go with Ms. Nash. Do you have public comments you'd like to give?
Yes, I'm unmuted.
Go ahead, ma'am. We can hear you.
Okay, my name is Peggy Nash, and first of all, thank you for the opportunity to address you today and for all the work that you do on our behalf. I have sent an email to Mr. Spinks and Ms. Canseco with greater detail than my 3-minute time allotment will allow today, but I want to make 2 requests of the board. I have been practicing clinical social worker for the past 51 years with no negative reports on my license. I have served on the State Board of NASW, have headed the private practice committee for the state, and under my leadership produced the first written material for the ethical practice of the independent practice of social work in the state of Texas. I have served on the adjunct faculty of the University of Texas in Arlington and Smith College School for Social Work. I was honored by my peers in 2017 with the Lifetime Achievement Award in Social Work. I also have been licensed as an approved supervisor for LCSW in the state of Texas. A perfect storm of occurrences has led me to currently be with an expired license. Prior to 2021, social workers were notified to renew their license through a form letter, a 2-page form letter, requesting CEU information and any negative activity on the license. In 2021, a blue postcard was sent instead, and for any number of reasons, I did not receive the notice. I understand that as the rules are written today, that fact is immaterial since the ultimate responsibility to renew one's license rests with me. However, as we can all recall, and you were referring to today, 2021 was hardly a normal year, with COVID raging and perhaps even for me, a declared disaster. Personally, because my husband of 50 years had a stroke and was hospitalized for weeks, followed by rehab for months. And my adult son, also living in our home because of health issues, was in the ICU on several occasions with life-threatening conditions. My world, like many others, lost its rhythm and predictability. I am making two requests. Number one, would the board consider rewriting the licensing law to handle the expiration of a license with the same care as it does with a license that is terminated for malfeasance? That would mean a licensee if a license is lost for any reason, a letter return receipt requested will be sent to the licensee. As Bob Stewart, who is asking to speak, can attest, the main reason for having licensing law is to protect the public. I have done no public harm. I missed a deadline. Number two, would the board consider making an accommodation, given my circumstances, age, body of work for 51 years, and allow me to pay back fees and whatever fines to reinstate my license promptly so as to do no harm to the clients I now serve in my practice by having their treatment terminated or transferred, a far more egregious consequence as a result of this law than I can imagine was ever intended. Thank you.
Thank you, ma'am. Mr. Stewart, did you have public comments you wanted to make? Mr. Stewart?
Now, are we okay?
Yes, sir. We can hear you.
Sorry, I was muted. Yeah, thank you. My name is Robert Stewart. Listening in on your meeting has been very informative and I am impressed. Thank you for the opportunity to provide input related to the specific circumstance clarified by Peggy Nash. I was director of clinical social work at Timberlawn Psychiatric Hospital in Dallas when Peggy joined our staff. Our standards were high and Peggy brought superb educational and practice credentials and became a highly valued staff member. I have known her as a colleague and friend for over 40 years and can testify to her clinical skill and personal and professional integrity. Texas social workers began the quest for the legal regulation of social work in the early 70s. In 1973, I was asked by the Texas Council of the 9 chapters of the National Association of Social Workers in Texas to chair a task force to develop a model for the legal regulation of social work that would have the full support of social workers in the state. A few sessions of the legislature later, it was signed into law. The ultimate purpose of the Texas social work law was to protect the public from unqualified or unethical practitioners. In serving over the years as president of the National Association of Social Workers at local, state, and national levels, I was directly involved in issues related to social work standards and ethical breaches. I know how demanding that can be and that the demands of the Texas Licensing Board are infinitely greater. There are those who call themselves social workers against whom the public needs protection. Peggy Nash is not one of those. It would appear to me that Texas licensing procedures, which are different from standards, should not only be designed to protect the public from unqualified and unethical practitioners, but also to not deprive the public of services of those who are highly qualified and ethical. To rescind Mrs. Nash's license due to an oversight on her part in the midst of difficult personal and family challenges is to deprive the public of one of the best qualified social work clinicians in our state. Mrs. Nash's suggested resolution of the issue seems to me to be very reasonable. A corresponding revision in procedures would have the effect of freeing up more board time to deal with the true threats to the public while avoiding the interruption of sound service delivery, especially in a time when mental health services are in dire lack of supply. Thank you very much.
Thank you, sir.
Thank you.
Ms. Prosperi, did you have public comments you'd like to give?
I do. Hi, my name is Natasha. Can you hear me?
Yes, ma'am.
My name is Natasha Prosperi. I'm a licensed clinical social worker. I'm going to talk about my experience with Rule 882.10. Do you know that the most dangerous moment for a person suffering from domestic violence is when they're about to leave an abusive relationship? I'm coming here to talk about my experience as an LMSW under clinical supervision working under a contract in a private group practice and how the BHEC Rule 882.10 perpetuated the abuse I encountered even after I left the group. I want to disclose a complaint pending against the group owner, and it is not my intention to influence the investigation findings. I urge the council to consider creating a whistleblower protection rule to avoid exposing new clinicians to the nightmare I suffered for more than 6 months. The cycle of abuse starts with a honeymoon phase. The group owner offered me the clients at my own office. She did all the billing, telling me what CPT codes and add-ons to use. She had a supervisor license, so I assumed she was doing things ethically. Then comes the tension building phase. As I start researching CPT codes and add-ons, I started questioning the owner's billing practices. I took my concerns to her, and she told me there was an ethical way to use them. In June of 2021, I told her that I will not use some add-ons because I disagree with the way they were applied. In November of 2021, I expressed concerns about clauses in the contract and other clinicians' credentials on her website. She told me that she would correct them, but ignored my observations. In February, I informed her that I would leave her practice in June. In March, she started bullying me after I confronted her for misrepresenting the credentials of another clinician on her website. The group owner requested a meeting with my clinical supervisor to complain about me. My supervisor told her that I was doing everything ethically and that she would sign my form to upgrade my license. In mid-May, the owner called me for a meeting where she threatened to terminate my contract that week if I didn't collaborate with her. She falsely accused me of soliciting clients because most of my clients wanted to follow me. Incident phase. 2 days later, the owner sent me a threatening email and copied her attorney. I consulted with my supervisor and left the group because I couldn't see clients in a place where I didn't feel safe. A week before I could upgrade my license, the owner filed a malicious complaint against me and told my clients that I did not have a license to practice, trying to disrupt the therapeutic relationship I had with them. The owner used the council rules to bully me even after I left her business. My license upgrade was placed on hold by the false complaint while the council investigated. In the meantime, she was doing business as usual. I had everything in place to open my practice in June after upgrading my license. I could not do that until the end of September when the enforcement office released my clinical license after I sent a long document with all the evidence I had. During those months, I had to develop a plan B to see my clients and secure continuity of care. I urge the council to consider creating a whistleblower protection rule to avoid exposing new clinicians to the nightmare I suffered for more than 6 months. Thank you.
Thank you, ma'am. Thank you.
Dr. Grothews, you have public comments you'd like to give?
Yes, thank you, Mr. Spinks. My name is Dr. Carol Grothews. I'm a licensed psychologist, and I'm just going to make a brief public comment since a lot of the changes have already been made during this meeting regarding the title and use of school psychologists. I do appreciate the council's recommendation to get an AG opinion. I think that goes a long way in helping TPA members understand that the board is not just making a rogue decision, but is trying to, follow the lines of the statutory intent of what this means, since this has been an ongoing issue and protection of the title of psychologist and what that means in the state. And that's the history of it. But I do understand that there's inadvertent consequences to having the LSSP license and having so many people not understand what that means. We really do appreciate the impassioned speech from the task historian, Ashley Arnold, saying that, in the wake of Vivaldi, people didn't even understand that there were school psychologists employed because they were LSSPs listed and people didn't understand that. However, given that, we really want to make sure that there's clear understanding and no inadvertent consequences, the use of licensed school psychologists, I think, should be removed from that title. There is no such license. I'm a clinical psychologist, and I'm a licensed psychologist, but I'm not a licensed clinical psychologist. There is not a licensed school psychologist. There's a school psychologist, there's an LSSP, and there's a licensed psychologist. So I hope that that is going to be removed in the next board meeting, but we do appreciate the discussion. Thank you.
Thank you, Doctor. Dr. Sartor, do you have public comments you'd like to give?
Yes, I do. Thank you so much, Mr. Spinks. And good afternoon, everybody. My name is Dr. Terry Ann Sartor, and I am a licensed professional counselor supervisor, counselor educator, and the liaison to the Behavioral Health Executive Council for the Texas Counseling Association. Additionally, I am grateful for the opportunity to serve on the BHEC Rules and Standardization Task Force. TCA supports the continuing education rules 681.140, 141, and 142 as proposed by the Texas State Board of Examiners in the September 9, 2022 meeting. Additionally, we appreciate the diligence of the Behavioral Health Executive Council and the Texas State Board of Examiners of Professional Counselors in working toward having consistencies across mental health licensing boards within this area. TCA will be hosting the 66th Annual Professional Growth Conference in November 9th through 11th in Dallas, Texas. And additionally, we would like to acknowledge the work of the public members to our mental health boards. Mr. Stephen Hallbauer, a public board member, the presiding member, and actually today's acting chair, will be recognized as at the TCA award ceremony on Thursday, November 10th. We are going to be recognizing him as the recipient of the Layperson Exemplary Service Award. So please join us in recognizing and honoring Stephen for this accomplishment. We appreciate and respect all the hard work of our volunteer boards. Thank you for listening, and TCA appreciates your time, efforts, and dedication. Thank you so much.
Thanks, Dr. Sartor. Ms. Dawson, do you have public comments you'd like to give?
No, thank you.
All right. Mr. Francis, do you have public comments you'd like to give?
I do. Thank you for the opportunity to speak today. Again, I always appreciate all the work you all do. First off, I just want to extend a huge thank you to BHEC and the Texas State Board of Social Worker Examiners for having Brian Brumley and Sarah Fassholtz attend our conference. It's just absolutely fantastic when members can engage with them and ask questions and just directly see the contact with you all. So I really, really encourage you all to continue to send everyone to all the conferences that you can. It's absolutely fantastic. I just wanted to support a couple of comments that you heard today. Ms. Prosperi mentioned a whistleblower rule. I think that really makes a lot of sense. In her case, she was in a situation where she was ready to go into private practice, all set to be take the next step into her career, and a complaint that looks like it could be retribution was filed against her. I really recommend that you all look at that case. And then as for Ms. Nash, she listed out her extensive accomplishments. She is the kind of social worker we need in Texas. We have a workforce crisis, and her depth of knowledge and her ability to connect and her current connection to clients is absolutely vital to the landscape. So I understand there's statute there that needs to be looked at, but my hope would be that if someone who has an extensive background in the profession has their license removed for what ultimately amounts to administrative reason, that there could be a way that they don't have to go through the full process again. I just would really hope that we could ultimately find a way to support social work. And then lastly, I just want to add, we on our website posted a report of the findings of the ASWB exam rate data. There are very, very troubling results. If you look at the ultimate results out there, you find that when it comes to passing the exam in Texas, 94.5% of people who identify as white ultimately pass the master's exam. Only 65% of those who identify as Black. Under the bachelor's exam, 85.8% of those who identify as white pass. 47.6% who identify as Black ultimately pass. If you're paying $300 a pop to take that exam, that's almost $1,000 that you spent trying to pass the test. I would really encourage BHEC to look at a one-time testing fee right now, put a moratorium out there, look at the ability to support those who are trying to get licensed, and understand that those disparities out there really do impact the diversity in the workforce and what ultimately it looks like. We need a wide range of identities in social work, and right now the test is a barrier to that. ASWB charges Texas applicants a $60 fee to go directly to them. That's a pressure point. Y'all can push back on them and get this test changed and more equitable for everyone by looking at the dollars that flow from Texas to ASWB. Thanks y'all for the ability to speak today.
Thanks, Will. Mr. Gomez, did you have public comments you wanted to give? Mr. Gomez?
Sorry about that. Can you hear me?
Yes, sir.
Sorry about that. Yeah, I'm Ruben Gomez. I'm an LPC supervisor here in the state of Texas, and I serve as the BHEC liaison for the Texas Association of Counselor Education and Supervision. And I wanted to thank the board for taking the time to find a solution to the continuing education rule changes and express support for the changes that establish the consistency and a higher standard in this area, and just really express appreciation for your commitment and hard work and everything you do. Thank you.
Thank you, sir. All right. Ms. Nash has her hand up again, but she's already spoken, used her 3 minutes. So I don't see any other hands. There was one other one up earlier there. All right, here we go. Mr. Crum, do you have public comments you'd like to give? Mr. Crum?
All right, there we go. You think I'd never seen a mute button before. Excuse me. My name's Philip Crum with Practice Mentors. I want to applaud the work of BHEC, Daryl, and his staff. They've done a fabulous job of cleaning up the dishes mess, and I'm glad to see that Patrick has finally gone high tech with the timer and light show. You go, Patrick. Unfortunately, the passing of the CE rules change proposals is a perfect example of what the Sunset Commission was trying to avoid through the development of the council, and that's the passing of unnecessary rules. There was no problem to solve, no empirical evidence to back it up, but the committee proposed it anyway. Then the boards failed to quantify the supposed problem and rubber stamped it with what we see as cosmetic edits. Now, on this proposal, we believe the council failed in their duty to ferret out and identify that required problem or hold other boards accountable for that. So now we're stuck with CE regulations that have gone from less than 1 page in the rule book to 4 full pages. Now we agree what we have today is an improved version of the proposal, but it's an improved version of a bad rule change proposal that never should have happened in the first place. If almost everyone is on the AP list now, why do we need an AP list at all? I just hope we can do a better job of recognizing unnecessary rules or rule changes in the future. And I appreciate you listening. Thank you.
Thank you, sir. And that concludes public comment. Note there are no telephone numbers.
Okay. Thanks, everybody. All right, we've reached the end. Any last words?
Just a note of thanks to everyone for participating, and Stephen, you did a far better job than I would have done. Thank you so much.
Thank you, Chair Canseco. You heal up quickly and get back here at running this meeting where you belong.
Thank you.
Thanks to all the staff as well. You guys are doing a fantastic job. We really appreciate all your hard work.
Yeah, and public thanks to Chair Halbauer for filling in today.
Absolutely.
Happy to do it. Y'all, each of us know the time commitment here and the level of involvement and the many hours outside of these meetings that we put in. So thank each of y'all for your service to this state. And I need a motion to adjourn.
So moved.
And a second?
Second.
Second.
Thank you. All in favor? Everybody take care, and we will see you next time.
Thank you
Thanks,
all.
everyone. Bye-bye.